call on Government Order of the Day number 5.
Substance Addiction, Compulsory Assessment and Treatment Bill. Interrupted debate on third reading.
Members, when we were last debating the third reading of this bill, Ian Lees-Galloway had the call and has 7 minutes remaining to speak. Next speaker then is the National Party. I call Barbara Kuriger.
Thank you, Mr Speaker. It's a pleasure to take a call on the Substance Addiction Compulsory Assessment and Treatment Bill. It's a bill that is replacing 1966 legislation, and it has huge potential to reduce the overall costs of addiction to society. Now, there's a lot of families out there who, for reasons of drug abuse, have family members who have really hit a low, and families are ill-equipped to handle it. The people themselves concerned have got themselves into such a low space that they're not available or not able to recognise or not able to seek help for themselves. And I think when it gets to that point, it is our role to look after those people as part of our society. So it is about repealing the Alcoholism and Drug Addiction Act from 1966. Most people who use alcohol or other drugs do not need compulsory treatment and can do well when they choose to engage in a treatment program. So they're still in the recognition phase and they can take themselves and ask for help. However, some people really are so unwell that they are unable to make that decision for themselves. So intoxication from alcohol or other drugs, even if frequent or distressing, is not the same as addiction. They're completely different. So we don't want people getting the impression that this is a piece of legislation that's going to be used for just taking people and restraining them in an institution for very little reason. It's going to be taken very seriously. And in December 2015, the government launched the Mental Health and Addiction Workforce Action Plan to help ensure that we have well-trained mental health and addiction staff to meet increased demand in the future needs of New Zealanders. And there are 4 key areas in which this plan works, and one of them is primary care and community care. One of them is the integration between primary care and secondary care. Then we have specialist training pathways, and then we have addiction treatment pathways. So detention is less dependent on the ability to lock doors than it is on the ability of services to keep patients sufficiently engaged in a way that minimises their interest and opportunity to absent themselves. So the committee has actually worked hard on this. The Select Committee on Health is a great team. We actually have really good discussions in our committee. It's a pleasure to be part of. And we talk a lot about the meaning of severe substance addiction. And for someone to be diagnosed with severe substance addiction, they need to have at least 2 of the features listed in the clauses below. 1, neuroadaptation to the substance. 2, craving for the substance. 3, unsuccessful efforts to control the use of the substance and the use of the substance despite harmful consequences. So the test is that they need to be able to, the specialists and those who are taking their care need to be able to identify 2 out of 4 of those. So generally the compulsory status lasts for a minimum of 6 weeks. So I really think this is an important piece of legislation. P and other drugs are causing huge problems to society in New Zealand these days, and Mr Speaker, it's my pleasure to commend this bill to the House. Thank you.